Hello everyone, myself Dr. Nilesh Pendurkar, and today I am going to share you a very interesting case. Actually, this case came to me at my clinic 10 to 12 days back. A 32-year-old female, she came to me for the complaint of weakness and history of recurrent urinary tract infection. Recently, she was admitted for that and she was given some antibiotics. She was having profound weakness and she told me that she is having some leukorrhea, and also during urination she is passing some granules, white granules in her urine. She was given some antibiotic. So I thought, as a homeopath, I prescribe her a dose of sarsaparilla, which is having a characteristic symptom of white sedimentation in the urine. But she called me on the second day. When she called me on the second day, she was in profound anxiety, in agitation. She told me that she is not able to stand, she is not able to walk, she is not able to do anything. So I asked her to again visit my clinic, and then I got some interesting facts about her. When she came to my clinic, she was so restless, so agitated. She was just like she was having hyperventilation. She was not able to walk, not able to even talk. There was palpitation, lot of anxiety. Actually, she was this type of symptoms for more than 2 months. And for the last 15 to 20 days, they were worse. She was not able to sleep. There was frequent urination, almost, or you can say there was frequent urination for more than 50 times, as she described me. Every time there is a profuse urination. Every time there was profuse urination. And there was increased thirst. Every 5 to 10 minutes she has to take water. She was taking Enerzar, that is ORS, and every 10 to 15 times or in half an hour she was going for urination. There was palpitation, anxiety, loss of sleep, profound weakness. There was trembling in her hands. So then I understand there is something deeper than the urinary infection. When I saw her all the reports, because that day she brought all her reports, there was decreased level of potassium, there was decreased level of sodium, decreased level of chloride, and her serum calcium was also low. There was increased sugar, almost her fasting sugar was 130 around, and postprandial sugar was around 150 or 160. Then in her previous history, since last 1 year, she was having blood pressure. One of the renowned doctor, he has started her metoprolol for her blood pressure. She was having chest pain at that time, and there was palpitation and tachycardia at that time. So she was given metoprolol 25 for her blood pressure, and she was better after that for some time. But there was intermittent chest pain she was suffering from. So I asked her to tell me more. Tell me more about her weakness. What she is exactly feeling. So she said, as if I am not able to hold anything. So that was because of muscular weakness she is suffering from, the potassium loss. So I said, then what you are doing? How you are managing your day? For 1 month you are suffering from this. So she told me she was admitted in the hospital. She was going to doctor every day, and she was taking some IV infusions. She was taking Enerzal, and after IV infusions she was somewhat relieved, and she tried to work. And then suddenly she told me something. She said, I always took Enerzal for feeling better, and sometimes I used to take Afresh, and then I can work for few times. I said, Afresh? What is that? I was not knowing what is Afresh. At that time, I was not knowing what is Afresh. So I usually inquire anything that benefits the patient and anything that worsens the patient condition. So as she told me that by taking Afresh, she feel better and she was able to do some work. I asked her, what is that Afresh? And then she told me that Afresh is a energy drink from a renowned Herbalife company, where she has to take it in the morning for 1 spoon, and then there is no need for food, and she feels fresh. So then I understand there must be something in the Afresh that is making her feel fresh. And then I understand that Afresh contains caffeine. And now the whole case I can understand in the context of caffeine. So she was taking that Afresh for more than 2 to 3 years. For more than 2 to 3 years she was taking that Afresh in the morning. So now I understand she is suffering from the chronic caffeine poisoning, that is caffeineism. So what is caffeineism? So caffeineism, when someone drinks too much caffeine, it causes a set of health problems. And what are the symptoms of caffeineism? The symptoms of caffeineism are restlessness and agitation. Secondly, anxiety. Thirdly, there is increased urination. Fourth, there is tremors, trembling, loss of sleep, that is insomnia. Then there is increased blood pressure and increased heart rate, tachycardia. There is dizziness, headache. And as you go on taking that caffeine, you need more and more caffeine to feel that energy, or to feel that energy boost. So she was previously taking 1 teaspoonful of that Afresh, and now after 2 years she was almost taking two spoonful of that Afresh. So now I understand that she is suffering from the chronic caffeine poisoning, and all the things she is suffering from is only because of that caffeine poisoning. So let's see all her symptoms in the context of caffeine poisoning, so that we can understand how the symptoms develop, why the symptoms develop, what are the pathophysiology behind all that symptoms, so that how we can treat her, and in what way we can treat her. So caffeine, we can find caffeine in different plants. When we are drinking coffee, tea, then there are cola, chocolates, all these natural things, they are containing caffeine. But there is also synthetic caffeine, and many energy drinks that we are getting in nowadays in bakeries or on counter, they are having synthetic caffeine, and people used to drink that synthetic caffeine to get some energy boost. Even the companies like Herbalife, they are giving that energy booster drink to drink in the morning, so that when people are fasting for their weight loss, they are not feeling tiredness. They are not feeling tiredness because of that caffeine. So ultimately, when they become habitual, they need more and more caffeine, and then you can see such set of symptoms which my patient had. So let's see her first patient, anxiety and insomnia. See, caffeine has capacity to block the adenosine receptor in our brain. So adenosine, it is in one study it is observed that in the day the adenosine levels are less, and at the night the adenosine levels are normal. Adenosine levels are increased. So adenosine is important for the sleep, for the deep sleep. The caffeine is a competitive antagonist for the adenosine receptor in the brain, and when adenosine is not able to get engaged, then there is no tiredness, there is loss of sleep, and the many brain transmitters, neurotransmitters like serotonin, then dopamine, they are increased. So there is a rush of thought in your mind. Because loss of sleep, you get continuous thought. So she was telling me, I'm not able to sleep all the night. There is a rush of thoughts all the night. There is no sleep. There is no tiredness, no sleep. There are many thoughts coming again and again and again and again. So it was happening because the caffeine has blocked the adenosine receptors, or caffeine has blocked the adenosine. So she was not able to sleep. It also increases the adrenaline level. So the patient is feeling some anxiety, or it triggers the flight or fight response. So usually these patients, they don't feel tired when they take caffeine, and they are always on alert mode because of increased adrenaline level. So that was the reason for the anxiety and insomnia. Then the second symptom she was having, I forgot to tell you, she was having some digestive problem. Like she was suffering from the acidity, gastrointestinal reflux syndrome, lot of food coming up and burning. So why these things are happening? She was suffering from this acidity for more than 1 year. It was increased in last 1 year. Because of the increased serotonin level, there is increased secretion of acid. And so because of increased serotonin, there is increased acid reflux. Also, the caffeine increases the gastrin. The caffeine increases the gastrin level, and which increases the gut motility, the colon motility. So there is loose stools and sometimes diarrhea, and that also brings weakness. Then, as you know, the patient was having high blood pressure since 1 year, and she was taking metoprolol for that. And why she was taking metoprolol? Because there was tachycardia with that blood pressure, there was palpitation. So there was also chest pain. So let's see all these three symptoms, and let's see all these three symptoms in relation to caffeine poisoning. So caffeine can increase the blood pressure because its stimulatory action on the nerve centers. So caffeine has stimulatory action on the nerve center, so it has capacity to increase the blood pressure. Also, the adenosine receptors in the blood vessels of the cardiac arteries, they causes the constriction of the cardiac arteries, and so there is less blood flow in the cardiac arteries. So she was suffering from some chest pain, like anginal pains. So because of less blood flow in her cardiac arteries, she was suffering from that anginal pain, and there was tachycardia. It was again because of that caffeine. So there was that rapid heart rate because of the atrial fibrillation, we can call. So adenosine is a what we can say, adenosine is a negative inotropic drug, negative inotropic in its action. Adenosine has negative inotropic in its action. So because of blocking of this adenosine, there is increased heart rate. There is increased heart rate. There is the adenosine effects is inhibited. The effect of adenosine is inhibited, and because of that there is increased heart rate. So it causes atrial fibrillation, increased heart rate, tachycardia. So caffeine was inducing the tachycardia in this patient. So we can see that time also she was, so 1 year back also she was consuming the caffeine, and because of that she was having that blood pressure and tachycardia. So she was switched to metoprolol. Then there is fatigue. So fatigue is because of two reasons: loss of sleep. So there is a lot of oxidative stress that causes the fatigue, and secondly there was low sodium, low potassium levels. So because of metabolic reasons she was having that weakness. So she was in such a weakness that she was not able to walk. There was no strength in her muscles. There was also increase in the urination, the amount of urine. So there was polyuria and profuse urination. So why this profuse urination? If you try to understand the action of caffeine on the kidney, you will get the answer. Caffeine acts on the afferent arteriole of the glomeruli, where it inhibits the vasoconstriction, and then because of the vasodilation there is increased plasma in the kidney, in the glomerulus, and because of that it causes the hyperfiltration. So because of dilatation at the afferent arteriole, there is increased filtration, hyperfiltration, and so the patient loses the volume. So there is hypovolemic shock, we can say. So see, she was almost urinating for more than 50 times. There is also sodium loss, natriuresis. There is also potassium loss. There is also sodium loss. There is also potassium loss. So because of this, she was losing too much water from her body. The sodium loss, potassium loss, and all this vicious cycle was going on and on. So when she was taking some IV infusion, she was feeling better, she was feeling somewhat better, but the process was continued. Still she was taking caffeine. Then hypokalemia. The hypokalemia was because of the loss of potassium from the urine. Then also caffeine has action on the renin-angiotensin system, where it increases the renin-angiotensin system aldosterone mechanism, and because of that there is again hypokalemia. It causes the diuresis. So it acts as a diuretic. There is also hyperventilation. Because of caffeine, because caffeine stimulates the respiratory centers in the brain. So when the respiratory centers in the brain they are stimulated, she was hyperventilating. So because of that hyperventilation, she was in respiratory alkalosis, which indirectly again causing the loss of potassium. Again there was increased blood pressure, which was increasing the renal perfusion, and so the loss of fluid again. So there was multifactorial things which was making her dehydrated. So almost for every day, every 5 minutes she has to drink that much water, you can say, or energy or whatever she was taking, and every 15 to 20 minutes she has to go for urination. So that was a vicious cycle going on, and she was not able to sleep. Just imagine, for 20 days she was not able to sleep for whole day and night almost, and continuously going for urination, and profound weakness. So there was another interesting thing I got in this case. She was suffering from renal stone, and her serum calcium level was almost 6, and she was complaining me about some small granules in her urine. That's why I prescribed her a homeopathic remedy called sarsaparilla. So forget the remedy. So then what is this relation of calcium with that caffeine? See, actually coffee is capable to produce hyperfiltration. So you can so after hyperfiltration of the urine, there is frequent urination. As a diuretic, you can wash out the stone. So caffeine is capable to wash out the stone. Caffeine or coffee is capable to wash out the stone, but there is another problem. The caffeine is capable to lick the calcium, in the urine. So it hampers the calcium absorption, tubular absorption of the calcium, and it also so because of that there is much calcium secretion in the urine. So caffeine increases the excretion of the calcium in the urine. So there is increased excretion of the calcium in the urine, and because of that she might be having recurrent renal stones. For last 2 years she was having recurrent renal stones or recurrent renal infections, maybe because of the granules, because of that stony granules, and she was having less calcium, serum calcium level. So now, and one more thing, she was also having that increased sugar level. So what may be the reason for increased sugar level? Maybe the hypokalemia. Hypokalemia may be the reason for her increased sugar level, because it was not that much great. So hypokalemia can causes the beta cell dysfunction in the pancreas, so there is less insulin secretion, and because of that she may be having what is called diabetes. There is another possibility that because of hypokalemia there is increased liver glucose production, and another possibility, because of hypokalemia there was there was less peripheral utilization of the insulin. So these may be the factors which was causing her, which may be the cause of the increased glucose level in this patient. So now I can understand the whole phenomenon of the caffeine poisoning. Why she was suffering, how she was suffering, what are the symptoms, how the symptoms develop, what is the chronology of the symptoms, how the symptoms develop slowly, and how she is suffering from all these days, and now how she is presented to me. So first I asked her to completely stop that caffeine. She has to stop that caffeine, because I asked her, why you are taking that caffeine? Then she said, previously I was taking small dose of that afresh. Then I was not able to sleep. Then I feel fatigue in the morning. Then as soon as I took that caffeine or that afresh, then I feel so energetic. I feel so speed up that I was able to finish my household work in just 2 hours. So that was the alertness she was getting, or that was the boost of energy she was getting after that caffeine. So that vicious cycle began: loss of sleep, insomnia, morning weakness, and that demands for the more caffeine. And so she got addicted to the caffeine. So ultimately she got addicted to the caffeine. The synthetic caffeine has more problem. The synthetic caffeine has more problem of addiction, and most of these market products, energy boosters, they are using or they are adding the synthetic caffeine. See, as I said you earlier, that coffee that we prepare, a cup of coffee, it is helpful for excretion of the renal stones, because there are many alkaloids in that coffee with caffeine. But in synthetic caffeine, it is more dangerous. It has capacity to do all the harm. To get poisoned by a cup of coffee is very difficult. You have to drink many cup of coffees to get poisoned by that cup of coffee that we usually drink. But the synthetic caffeine, it is very potent. It is very potent poison. And what that companies they are claiming, the quantity of the caffeine, they are not I think rationalized. They are not checked. They are using more caffeine in that than the required doses. Who knows? So what treatment I gave her? We have a very interesting drug, and the drug is, of course, caffeine. Homeopathy is similia similibus curantur, the substance which is capable to produce some set of symptom in the individual. When we give the same substance in homeopathic potency, is capable to reduce that set of symptoms, or capable to cure that symptoms. So that was the exact application of the homeopathic drug. So she was poisoned from the caffeine, so I have to give her caffeine in homeopathic potency. So I asked her to wait in my clinic for half an hour to 1 hour. I gave her the homeopathic drug Coffea cruda in 200 potency. I asked her to repeat every 5 minutes. Within half an hour, her tremors gone. Almost 70 to 80% reduction in her tremors. Her palpitation and anxiety drastically improved. She was able to get calm, relaxed. There was no trembling. She was relaxed. She was not hyperventilating. So now I feel confident. Yes, my diagnosis is right. I'm on the right pathway. So I gave her 3 days medicine, Coffea cruda, and I asked her to take every 1 hour apart. So she came to me after 3 days. She said she was able to sleep 3 to 4 hours in a night. Her rush of thoughts was much less. There was trembling, but it is drastically improved, almost 80% improvement. There is no frequent urination. Previously it was 50 times. Now it is in the night it is 4 to 5 times. In the day it is 7 to 8 times. It is drastically decreased. Then there is no thirst. Means the thirst is much improved. Weakness is much improved. There is no anxiety. There is no palpitation. Her BP was normal. So I continue the medicine for next 3 days, every 2 hourly, and then again after 3 days she came to me. She was too fresh. She was getting good sound sleep, no rush of thoughts, almost no palpitation, no tremors at all. Then no thoughts. Then urination was almost normal, no profuse urination, no frequent urination. Then I asked her to do all the sodium, serum sodium, potassium levels, and they came absolutely normal. There was no thirst. No thirst means normal thirst. There was no increased thirst. Then she was able to sleep sound at night. There was no frequent waking. Just she wake up for 2 times in the night for urination. No palpitation, no weakness. She was able to do her household work slowly, but she was very fresh. There was no fatigue and nothing. So I continued her medicine. The last follow-up was also very good. She's almost relieved in all her symptoms. I asked her to continue the medicine because she's suffering from the chronic caffeine poisoning. She has to take the medicine for some days. So why I'm sharing this case to you? Because I think, and I'm thinking that nowadays the energy booster drinks, they are available on the counters in the bakeries. So many of us are taking them, or many young generation especially, they are taking the energy booster drinks. Even these companies like Herbalife, they are promoting that energy booster drinks to escape the meal, because the person is feeling energetic. He's not feeling any tiredness, though he is not having food. So people used to take it regularly. Caffeine poisoning can be happen to anyone. It depends on genetics. It depends on different individual threshold. We cannot say that this person or there is no exact dose of the caffeine poisoning. Especially more than 550 milligram, it is possible. It is possible for caffeine poisoning, but it depends. It varies from person to person, but it is very risky. This lady, she was suffering a lot from that caffeine poisoning, and I am anticipating that more and more such cases will come to our clinic with caffeine poisoning in future. So I think we should be aware of it, and we should take the symptoms very meticulously. We should find out the symptoms. We should find out what patient is taking, what they are doing, and then we can give a good result with whatever the pathies. We can give good results to our patient, and I'm very happy that my homeopathic drug coffee worked excellently in this patient to relieve her. Thank you for listening.